Good morning, ladies and gentlemen. Welcome to Kinfon Dermatology Classroom. Today I would like to preview my next lectures on the multiple phases of atopic dermatitis among Asian population. We know that atopic eczema is a condition with many phases of presentation. A child with atopic eczema might walk into your clinic with acute eczema, subacute eczema, and chronic eczema. Acute over the face, subacute over the body, and chronic lichenified over the lower limbs. Acute plus bacterial infection, subacute plus fungal infection, eczema hepaticum, cocciceum, molluscatum, etc. etc. So how are we going to look at this complex disease? Based on my last 5 years of review of more than 500 cases, I compiled the 15 different patterns of atopic eczema into this little booklet. In this booklet, I organize it more systematically based on 4 aspects. The first aspect is the changes in pattern according to age group, followed by the morphology according to the chronicity of the disease. Thirdly, the complication often are irritants, allergens, and infections. And not to forget the 23 minor features of atopic eczema according to Hanifin and Rashkar clinical criteria for atopic dermatitis. Without further delay, let's take a look at the first one, which is the pattern according to the age group of the patient. We know that in the first 2 years of life, especially among the mild to moderate that contribute to 90 to 95% of patients, the pattern is bilateral, symmetrical over the face, the outer aspect of the elbows, and the outer aspect of the shin. So this is the most common pattern. This is a classical example, more over the exposed and frictional side of the extremities and the face. Of course, about 5 to 10% of the patient, the eczema over time become more severe and start to affect other parts of the body. But what was noticed in these 500 cases, even among the top 0.5% of patients with severe atopic eczema, they have the tendency to spare the perinasal, perioral, the axilla, the groin, and area with thick skin, which is the palmar plantar area. This is a very classical example in which the eczema sparing the perinasal, perioral, the nappy area, as well as area with thick skin, which is the stratum corneum over the palmar plantar area. For the toddlers and school grade age children, the pattern changes accordingly. The 5 most common patterns recognized in this group of patients are the forehead and flexurals, extended flexurals, dorsal feet, angry buttocks, and generalized pattern. And the most common among these 5 is the forehead and flexural pattern over the area of friction, trapping the sweat in front of the neck area, bilateral symmetrical over the elbows and behind the knee. So this is the most common pattern for the children after 2 to 3 years old. Again, they are bilateral, symmetrical. Why they have a strong predilection to the folded area? Because the folded area, the skin is thinner, they have a tendency to trap the irritants and allergen. At the same time, with frequent flexion extension, this will create a microtrauma over the folded area, and stretching activity together with auto skin pH, skin humidity, and skin function, they will end up with microbial dysbiosis. Another pattern that getting more and more common in urbanized community like mine is the parents have a strong misconception that atopic eczema is due to poor hygiene. As a result, they use strong detergent to put on the toilet seat to clean it clean, to make it clean. As a result, when the patient sit on it, they get this what we call angry buttock syndrome. In fact, my team has become a professional buttock readers for my atopic eczema patient with super hygienic parents. Because we just look at how complete or incomplete is the circle, we roughly know what personality and what posture they use when they sit on the toilet seat. And as you can appreciate, on the left hand side, they have an incomplete circle here because they are very anxious personality. Before they sit, they're going to run away. In this case, they have a complete pattern suggestive that this patient will have a very relaxing personality. They will sit there comfortably for half an hour. When they stand up, they get angry buttock syndrome. To manage this, of course, you can't judge the toilet based on whether it's white or not, and you can't taste it as well. So normally, if the toilet is not cleaned by themselves, usually ask them to put a toilet paper on top. And of course, for boys with hanging appendages, they need to put another piece to protect their important, valuable appendages. Otherwise, they might end up with angry bird syndrome as well, as in this case. So if any of you would like to know more about the myriad phases of atopic eczema, please visit www.pediatricdermatology.com.my. Thank you very much for your attention.